How dangerous is gestational diabetes for mother and baby? According to the definition of the World Health Organization, WHO, gestational diabetes or gestational diabetes is a condition of glucose intolerance of any degree, appearing or first detected during pregnancy. This condition often has no obvious symptoms, making detection difficult and usually disappears after 6 weeks after giving birth. The following subjects are at high risk of gestational diabetes: overweight, obesity, family history, having someone with diabetes, especially in the first generation, history of giving birth to a baby greater than or equal to 4000 g, a history of impaired glucose tolerance, including a previous history of gestational diabetes and positive glucosuria, increases the risk. Age. The risk of gestational diabetes increases with age, especially after age 35. Abnormal obstetric history, stillbirth, recurrent miscarriages, premature birth, or fetal malformations of unknown cause are all risk factors. Race. Asians are at higher risk of gestational diabetes. Polycystic ovary syndrome. Gestational diabetes affects 3 to 7% of pregnant women and can pose many risks to both mother and fetus if not properly monitored and treated. Effects of gestational diabetes on the mother. Pregnant women with gestational diabetes are at higher risk of complications such as miscarriage, stillbirth, premature birth, gestational hypertension, polyhydramnios, urinary tract infections, pyelonephritis, and caesarean section. In the long term, the risk of developing type 2 diabetes and related complications, especially cardiovascular complications, also increases. Compared to normal pregnant women, those with gestational diabetes face a higher risk of complications during pregnancy, including common complications such as 1. High blood pressure. Pregnant women with gestational diabetes are at higher risk of developing high blood pressure than normal pregnant women. High blood pressure during pregnancy can lead to many serious complications for both mother and fetus such as preeclampsia, eclampsia, stroke, liver failure, kidney failure, intrauterine growth retardation, premature birth and increased perinatal mortality. The rate of preeclampsia in pregnant women with gestational diabetes is about 12%, higher than that of those who do not have this disease. Therefore, regular blood pressure measurement, weight monitoring and proteinuria testing are essential in each regular prenatal checkup for pregnant women with gestational diabetes. 2. Preterm birth. Women with gestational diabetes are at higher risk of preterm birth than those without the condition. Causes of preterm birth include poor blood glucose control, urinary tract infections, polyhydramnios, preeclampsia, and high blood pressure. 3. Polyhydramnios. Polyhydramnios usually appears from the 26th to 32nd week of pregnancy and also increases the risk of premature birth in pregnant women. 4. Miscarriage and stillbirth. Pregnant women with gestational diabetes are at increased risk of spontaneous abortion. Pregnant women with a history of recurrent miscarriage should have their blood glucose levels checked regularly. 5. Urinary tract infection. Pregnant women with gestational diabetes who do not control their blood glucose well are at high risk of developing urinary tract infections. Urinary tract infections may not have obvious symptoms, but they cause an imbalance in blood glucose and need to be treated promptly. If left untreated, the infection can lead to acute pyelonephritis, which can lead to other complications such as ketosis, premature birth, and amniotic infection. 6. Long-term effects. Many studies have found that women with a history of gestational diabetes have a high risk of developing type 2 diabetes in the future. In addition, pregnant women with gestational diabetes will increase the risk of diabetes in subsequent pregnancies. Pregnant women are also susceptible to obesity and excessive weight gain after giving birth if they do not have a proper diet and exercise regimen. Effects of gestational diabetes on the fetus. 1. Excessive growth and fetal macrosomia. Excessive fetal growth is caused by increased glucose transport from the mother to the fetus. This glucose stimulates the fetal pancreas to secrete insulin, increasing energy needs and promoting excessive fetal growth. 2. Hypoglycemia and metabolic disorders in newborns. This condition occurs in approximately 15% to 25% of newborns from diabetic pregnancies. It is usually caused by a poor response of the fetal liver to glucagon, resulting in a decrease in the rate of glucose production from the liver. 3. Respiratory diseases, respiratory distress syndrome. In the past, respiratory distress syndrome in newborns was the leading cause of death, accounting for about 30% of newborns from diabetic pregnancies. Today, thanks to methods of assessing fetal lung maturity, this rate has decreased to about 10%. 4. Neonatal jaundice. About 25% of pregnant women with gestational diabetes may experience increased hemoglobin destruction, leading to increased plasma bilirubin, causing jaundice in newborns. 5. Polycythemia. Pyrocytosis is a common condition in newborns of women with gestational diabetes. 6. Long-term effects. Increased risk of childhood obesity, associated with early onset of type 2 diabetes and psychomotor disorders. Children born to mothers with gestational diabetes are 8 times more likely to develop diabetes and prediabetes by age 19 to 27. Here are some measures to prevent gestational diabetes that women can apply. Add foods rich in fiber, low in fat and calories such as vegetables, fruits and grains. Exercise gently for 30 minutes every day to improve the health of mother and fetus. Maintain a reasonable weight if you intend to become pregnant. Avoid gaining more weight than your doctor recommends. Thank you everyone for taking the time to watch this video. Don't forget to like, share and subscribe to support my channel.